good conversations coming up. It's now my pleasure to introduce Dr. Ed Williams, current president of the American Academy of Facial Plastic and Reconstructive Surgery. Ed,
thanks.
Talking on the weekend face.
Yeah. All right. Thanks, Steve. That's a hard act to follow, huh? A couple of things I just want to mention. Listen to Tim's talk. I think there were a few things that are very important for folks just starting out to pay attention to, and don't underestimate the technical difficulty of fat grafting and deep plane lifts. Those of you who know me, for 20 years I've been doing subperiosteal brow mid facelift, and I do deep plane lift. And I mentioned yesterday, 80 to 90% of our patients get fat grafting as well. I completely agree with that, and I've heard comments where I don't think that fat is necessary, and I completely subscribe to Tim's thinking. You can't convince me that just lifting tissue solves everything. Heath and Bart, could you put the timer, reset the timer for me? So what I'm talking about today is my version of the weekend lift, and basically a weekend lift is a mini lift. And even though it makes a very small part of our practice, why do we do it, and why do we call it the weekend lift? And I just want to share my experience for the last, I think around 2005, I started doing this mini lift, because prior to that, I thought, well, if I'm not going to get the kind of result that I want with a more extensive lift, why do it? But as you know, we had franchised type organization that was promoting a lift, infomercials, and in certain markets was very heavily advertised and marketed, and ours was no different. So I thought to myself, what do I got to do to kind of combat this? And now I'm just reflecting back on so it's basically it's a mini lift. And Dr. McCullough mentioned something yesterday, and I think it's really important for folks learning how to do these things, or inexperienced, or even just out of your fellowship. Go with what you know, and go with the easy stuff first. Take good care of your patients, and then you start to expand your indications and get more familiar with things. But it's a pre and post tragal incision. It goes below the preauricular tuft of hair, and I go out about 4 to 6 centimeters. It's what we've learned as a mini lift, and just do a little imbrication. So if you can see here, why is it different from traditional surgery? It's a procedure where the incision just goes along the red line. I irregularize it. I do go post tragal. And it can be done under local, I use PO sedation, or with intravenous sedation as well. And I just go up behind the hairline a little bit. It takes about an hour to an hour and a half, and as I mentioned, some oral sedation. There are people that do not want anesthesia. Probably 80, 90% of the time we use some IV sedation, but there are those folks that just want it with PO meds. And I've done it many times. It's not my choice to do it that way with most patients, probably 10% of patients, but those who are pretty stoic and want it do well. A couple days of bruising. Sutures are in about the same that we do for a traditional lift, about 5 to 6 days. And here's the thing, when I see these patients, the key to this is managing expectations. And so what I tell patients with this little mini lift is the only thing we're really improving is the jawline. That's it. Don't expect anything in the neck. If you're looking at the neck and that's of concern to you, this is not the lift, it's just the jawline. These are very subtle results, but I've got to tell you, one of the comments that my fellows always say to me is that these are the happiest patients. The other thing that always amazes me in consultation when you're seeing these folks, again, we're not really getting much in the neckline, just a little subtle jawline improvement. Some are less than others, but I'm very, very careful to tell them, say, I just go pull back a little bit, and I say, that's it, and they go, yep, that's it. But again, some of the happiest patients that we've had. The other thing that never ceases to amaze me is that there are those people that just don't see their neck. Their neck doesn't bother them. I mean, they'll come in and they'll say, yep, this right here, and I said, well, you're not concerned about your neck? No. And I mean, they've got a lot going on there. So again, they're I think as long as we're educating folks, they're the consumer, so I don't have a problem with that. Here's our incision. We kind of, I mean, if you think about what that franchise medicine did, they made a system out of this. So we have a system. We do it the same way every time, pretty much. And carry my incision up. Here's nothing fancy about this, and rather than video, I can go more quickly here with just flipping slides. Here's our undermining. Do our imbrication. And that's about how much we get. Post-auricular, you kind of get a little bunching up in there, and it settles down with time with massage. Here's just trimming our flap. We put our one key suture in up here in the front. I trim down by the ear. Absolutely no tension on the earlobe to the skin. One chromic suture, and then trim off post-auricularly. Not a lot of skin. I put a little drain in there, a little 8 French red rubber catheter. Dressing goes on, and then comes off the next day. We have another kind of a graduated approach to this. If some people say they don't have a lot going on in their neck, but they got a little something there, I carry this up, and I call this the extended weekend lift. So if you take a look at that incision, it just goes up higher. It doesn't go all the way back in the hairline. But again, same thing, and I'll just show you the difference in the incision here. Okay, there's the incision. If I go back, it just comes up, it goes back toward the hairline, but it allows me to undermine a little bit more down along posteriorly, anterior to the hairline, that it lets me get a little bit of the neck with it. So again, it's what I tell patients, it's a customized procedure that gives just a little bit of improvement along the neck. Stitches staying the same. I won't do this with just PO meds. This is where I tell the patients, look, if you want me to do this, I've got to use some sedation. And this is just, again, just my experience with it. Here's a woman who had what I call an extended weekend lift. It gets a little improvement along the neckline. Same thing here. It's not meant to really do an awful lot. And more limited improvement here. Another patient, a younger individual. Many of these patients end up coming back years later, and patients say to me, how long does this last? And I tell them, I don't know, anywhere from 4 to 6, 7 years. And there's a population that says, you know what, I'm working right now, I don't want the real lift, I just want something minor. I find that when and I'm just sharing my experience, when we do a seminar, which we do a couple times a year, or even a webinar. I think once we did a webinar to our database, we had 55, 60 folks on, and we did the math on it, and it was extremely good use of our time. Another example, younger individual, a little liposuction. So as I mentioned, we'll do it as a seminar, webinar. It's on our website. There are those people that are just afraid of anesthesia. And I think as long as we're educating people, they're the consumer, who are we to say that I'm not going to do that little lift? Like I said, there are some people that are just, and I guess it's, to me that was a little epiphany, realizing that there are some people that just are not bothered by their neck. And I got to tell you, it's hard to argue with happy patients. Per unit time, this is some of the most gratifying work. And like I said, I'm only telling you what my fellows say. I mean, I can't believe how happy those weekend lift patients are. I know Mac Cheney about, it had to be about 15 years ago, had a spot on the news in Boston or whatever, and I knew his fellows at the time, and they were saying, he does 4 or 5 of these a week, and he's got the happiest patients. So I'm just sharing with you my thoughts. Is it the comprehensive lift that I love doing? No. I believe it has a role in a facial plastic practice, especially when you are starting to establish relationships. The key to happy patients here is really managing expectations. I mean, I can't stress that enough. And we have I've gone back now, about 1 in 30 or so. There's actually those who have a real kind of bulldog, heavy jowl, are going to be failures. And I went back and looked, about 1 in 30 of our patients I see them back at a year, and they just don't have a result, and I end up just doing it gratis. And those patients end up happy. But I think the key here is really, really managing expectations. So those who have a lot going on in the jawline are going to recur, and they're just not going to look great. But it is one of the more gratifying procedures in our practice. And that's it, and I thank you for your attention.